Yeah, my name is Alec. I was born on July 26, 1996.
All right, and may I check your wristband as well? Awesome. It says Alec right there. Um, July 26, 1996. Perfect. Thank you so much. So today I have orders from the doctor to do a head-to-toe assessment on you and just get a good idea of your general health and see if there's any other problems. So I'm just going to do this, like I said, a head-to-toe assessment. We're going to start out at the head and work our way through, just to make sure everything's in good functioning order. So we're going to start out at the head there. Have you had any, or actually, let me ask you a couple questions real quick. This is just assessing your your psychology or neurology, however you want to put it. Do you know where we are today?
We are in the Kitty Care Center at the gym.
We are in the Kitty Care Center at the gym. Um, the Do you know what year it is?
I think it's 2022.
2022. Your thought is correct. Do you know who the current head of state is? I'm asking hard questions.
we talking about the president, Joe Biden?
No, who's the current president?
Okay, Joe Biden.
Okay, yes, that is correct. What I was testing there is just your basic neurology, making sure you're present. You can answer my questions thoroughly. You have good eye movement as well. You're making eye contact with me. You don't have any slurred speech. I can understand everything you're saying. And it looks like your movements are well as well. I mean, can you touch your nose? Can you look up and touch your nose? Yeah. Perfect. So your motor skills are good. On the Glasgow Coma scale, you are at a 15 out of 15. So you don't have any consciousness problems right now. Starting at the top of your head, I'm going to have you go ahead and take off your hat. I just want to inspect your scalp. There's no out of expectation loss of hair on the top of your head. I'm not trying to be funny or anything. I know it's genetic. I know your grandfather. Now I do see a couple bumps on the top of your head. Are you aware of those, or do you know what they are?
Yeah, I had a mole removed when I was a teenager. This little scar.
Oh, okay, perfect. Have you had any headaches or anything like that lately?
Nope.
No? Okay. So your head's in good functioning order, your skin and scalp looks clean, there's no dandruff on there. Your general appearance, you have good hygiene, so I know you're in good health as far as skin is concerned. Just a quick test, I'm going to test skin turgor. It looks like you don't have any tinting, which means you are hydrated, because the skin moves right back into place like it should. Let's see. Also, your skin is bilaterally the same temperature throughout, which also means you have good circulation. But I'm also going to do some other tests for that circulation. So starting at your next part is going to be your eyes. That reminds me.
Hey, Nurse Ben, can I put my hat back on?
You may put your hat back on, absolutely. But just don't look forward, because the shade from your bill could affect your pupils. So what I'm going to do at this point is I'm going to test your eyes. So I'm going to have you look at my finger here, and I'm just testing the reflexes of your pupils. So I noticed that your left pupil is slightly bigger than your right pupil. Have you been told that before?
I've not, but I do know that I'm a left eye dominant. If that
You are left eye
matters.
dominant. Have you had any eye problems?
Yeah, I have glasses. I don't wear them very often,
Okay.
but I do have a prescription.
So just going down my Perla list as far as eyes are concerned, what Perla means are your pupils are equal, which I mentioned. It might just be the light in this room, but to me it looks like your left pupil is slightly more dilated than your right. But they're also in expected range, pupil size, which is going to be 4 to 6 centimeters. The, let's see, so equal round, they're both round. They're both reactive to light, they're light sensitive, and you do use reasonable accommodations with your glasses. But the other thing that occurs when I put the light in your eye is that the eye that's not receiving the light also has a reaction as well. And all of those things are within expected range. Have you had any problems with your ears or any discharge with your ears or pain?
Sometimes they get a little waxy.
They get a little waxy. Is it okay if I inspect them?
Please do.
All right, this one looks good. I'll look at the other one. Looks great. Have you, now to your nose, have you had any drainage lately or any mucus?
My allergies have kicked up a little bit. Nothing
Okay.
too bad.
And what is the color of this mucus?
I don't know. I don't look at the mucus very much. I'm just a little stuffy.
Okay. If you don't mind looking up towards the ceiling, I'm going to check your nasal mucosa. And your nasal mucosa is moist, and the color is within expected range. Now, with your mouth, have you had any problems swallowing or eating or?
Yesterday I ate a hot slice of pizza, so the top of my mouth kind of hurts.
I'm sorry.
It's okay. Other than that,
Well, it's worth it. It's pizza.
it is. Yeah.
So go ahead and open your mouth. Say "ah" for me.
Ah.
All right. The mucosa in your mouth is also within expected range. It's a little bit darker than your nose, your nasal mucosa, and it is it's moist.
What does that mean?
Mucosa is just really the wet lining.
Yeah, but what does it mean if my mouth is darker than my nose?
It's expected.
Oh, okay.
It should be.
It's normal.
Yeah, it's normal. So the last thing I'm going to assess is your neck. So what I want you to do is look straight up for me. All right. I want you to look to your left and look to your right. All right. So you don't have any jugular vein distension, which is fantastic. The other couple things that I noticed with your neck is that your larynx is in line. It's within the midline of your body, so your neck is expected.
Kind of normal.
Yeah, it's neck. It's symmetrical. All right, so making my way down from your neck. Have you had any problems with your neck? Any pains? With mobility? No, just popping your neck.
Yeah.
All right. Also, a couple other movements that I'm going to have you do with your neck is I'm going to have you put your ear towards your right shoulder and then towards your left shoulder. Awesome. And I've already had you look left and right and up and down. So it looks like you have full mobility of your neck, which is fantastic. As we continue down this list, now, just a side note real quick, is when we're done with this, I'm going to have you look at this paper and try to check off everything that I've done with it, okay? So we can talk about, or we can watch the video afterwards and make sure I did it all.
Are you graded on how well I do?
On Thursday I will be. So the next parts we're going to do is I'm now going to assess your heart sounds and your lung sounds. To do that, I'll use my stethoscope and let me turn off this flashlight real quick. All right, with the lung sound or with the heart sounds first, just to assess your cardiac. All right. All right, so first I'm going to listen right here. This is going to be your aortic point, pulmonic, Erb's point, tricuspid, apical point. I'm going to listen here for 1 minute. I'm going to turn it over to listen to the bell to listen to heart murmurs. So with the, also what I'm going to check for is, may I check your arms here? Just hold them out for me. Actually flip them over, sorry. So what I'm checking for there is pitting edema. You don't have any edema. I'm checking for capillary refill. Capillary refill is less than 2 seconds on each of your fingers. That means you have good circulation to your fingers. I'm also going to check your legs for edema and capillary refill. So, all right, there's no edema. And if your feet were out, I'd check your toes, each one of them. Those can also be checked for capillary refill, but you're good within the expected range. I'm going to palpate your radial pulse. So radial pulse, it is a 2+ on each side. I can also check your brachial pulse, your apical pulse, your carotid arteries, only one at a time, not bilaterally. Your dorsalis pedis pulse is 2+. Your tibialis anterior pulse, posterior. Tibialis posterior pulse is bilateral. I can check your popliteal and your femoral, all for pulses, and they should be the same. Just after a workout, you'd probably be a 3+, maybe a 4+. After cardio, you'd probably be 4+. That just means it's beating really hard.
Well, you know we don't do cardio.
Yeah, we don't do cardio. We're powerlifters. Let's see. So I got all the heart stuff. Now I'm going to listen to your lungs. So with your lung sounds, I'll wait till you finish drinking.
Sorry, go ahead.
Because I'll listen to those sounds later. So with your lung sounds, I'm going to check 4 spots on your chest, 1 on each side, and then 4 on the back, after I untwist my stethoscope. So with the diaphragm, each time my stethoscope touches you, I want you to take a deep breath for me and release it. All right, now grab your left shoulder with your right hand. Awesome. And the other side. Thank you. And same on the back. Excellent. So all your respiration is even and unlabored. It is also eunypnic, which just means it's within normal range. So you're breathing between 12 and 20 respirations per minute. Let's see. So after respiratory, the next part is going to be your gastrointestinal system. So of course, with all those touch points, with your lungs and with your heart, I would do that on bare skin in order to actually hear it better. So with your stomach sounds, I would have you laying back just because it's easier to access. Yeah, we don't want you to hurt yourself. So I will start in the lower right quadrant, which is going to be at the beginning of your large intestines. Here I would listen for up to 5 minutes, depending on when I hear your borborygmus. Borborygmus is just normal stomach sounds. So if you're 3 to 5 seconds, that means you have normal bowel movements currently, right? So do that in each segment. If it's less than 1 second, then you probably have diarrhea. If it takes up to a minute, you're probably constipated. Then I'm gonna flip it around to the bell up at the top part here, or at the really at the bottom of your xiphoid process, and I would listen to Brewy. Brewy, if I hear Brewy, then we need to get you to the doctor almost immediately, right away. Okay? But you're fine.
What is Brewy?
Don't ask me that right now. I totally forgot. It's an alarming sound for your heart. Let's see. So the next part I'm going to do. Let's see. I got gastrointestinal. I got your skin. I'm also going to test your range of motion and strength. Now, so with range of motion, I'm going to test 2 points on your upper extremities and 2 points on your lower extremities. So first off, I'm going to have you hold your arms up like this with your hands facing you, and I want you to straighten your arms out. All right, that's called extension. Now I want you to bring back. That's called flexion. And you had no problems in there. Now with your hands, I want you to push against me. Awesome. Now pull towards you. Wonderful. You have strength. You can fight against me. And I'll check your wrist. So with your wrist, with them straight, it's going to be flexion. Nope. With them straight, it's going to be extension. If you raise your knuckles towards the ceiling, that's hyperextension. If you put them straight down towards the floor, that's flexion. All right. So the next part is I'm going to assess your knees, your knee range of motion. So with your knees, I want you to extend your legs till they're straight. Perfect. And put them back down. Great. And can you pull them more towards your butt? There you go. So what we demonstrated there is extension and flexion. I didn't feel anything weird about them. So now I'm going to assess your ankles. I want you to lift your feet towards your toes towards the sky, I guess, yeah, or your toe knuckles, whatever. And now point them straight down to the floor. All right, what we demonstrated there was dorsal flexion and plantar flexion. Now with your legs, I want you to push against my hands. Perfect. Now try to pull them down. Great. So you have strength and range of motion in your lower extremities and your upper extremities. Have you had any problems with your knees, hands, feet, any joint issues?
Yeah, my knees get kind of achy sometimes.
Oh, I'm sorry to hear that. I can put that in the chart. So now I'm going to have you stand up for me. Wonderful. Can you stand on one leg, on your left leg? Oh, okay. You don't need assistance. Now try your other foot. Perfect. No assistance needed. I want you to walk to that chair and then walk back. Very good. Excellent. So you may take a seat. So what I was testing for is your gait, your balance. So both your gait and balance are within expected range. You don't need any assistance ambulating, which just means walking. Because of that, you also rank very high or very low on the Morris-Fall scale. So with the Morris-Fall scale, that's just basically an assessment to see if you are at risk for falling, right? You are a very low risk because